Giardiasis is also known as beaver fever. It is caused by another protozoan, Giardia duodenalis, which is also called Giardia intestinalis or Giardia lamblia, which is a gastrointestinal parasite, so the clinical symptoms include stomach or abdominal cramps, upset stomach or nausea, bloating, gas, diarrhea, greasy stools that float, dehydration, malabsorption resulting in weight loss, and failure to thrive in children. However, many infections are asymptomatic. Like entamoeba, Giardia has a simple life cycle with a hardy cis external or environmental stage and a trophozoite intestinal stage. The trophozoites multiply by dividing asexually. Transmission is through the fecal-oral route, directly from poor hand hygiene or indirectly through contaminated food or water. You can see the Giardia life cycle in the diagram with the cis and trophozoite stages. Giardiasis is a global disease. Children are more likely to be symptomatic than adults. It is a zoonotic disease transmitted from wildlife, for example beavers, or livestock, for example goats, cattle, sheep, and pigs, and companion animals, for example dogs and cats. This disease is reported mainly in Canadian communities, where unfiltered surface water is used for drinking water, and prior to 2001, it was the most commonly reported cause of drinking water-associated disease outbreaks in Canada. Risk factors include travel to endemic countries, exposure to childcare settings, close contact with giardiasis cases, ingestion of contaminated drinking water from untreated surface lakes or river water, contact with infected animals, and being a man who has sex with other men, and the risk exposure of the last two groups of individuals may be occupational. Individuals in the last group may be sex-trade workers. In the past 10 years, the incidence rate of giardiasis has been decreasing slowly at national, provincial, and municipal levels. The rates in Ontario were similar to national rates, decreasing from 12 cases to 9 cases per 100,000 population. This corresponded to between 3,500 and 4,000 cases a year in Canada and around 1,200 to 1,500 cases a year in Ontario. The rate in Toronto was higher than the national and provincial rates, between 12 and 18 cases per 100,000, with around 350 to 450 cases a year. Although we don't really know why that is, the investigations carried out by Toronto Public Health indicate that the exposure setting for many of the cases was travel outside of Canada, so the most infections were likely not acquired locally, although some exposures were related to travel within Ontario and also within a private home. Exposure sources were food, drinking, and recreational water, as well as sexual contact. Giardiasis is diagnosed by detection and identification of cysts in stool specimens by microscopy. Cysts are oval or football-shaped with 4 nuclei and are small, only 10 to 15 micrometers, so magnification using a microscope is essential. Trophozoites are pear-shaped with 4 pairs of flagellae and 2 nuclei. They are also the same size as cysts, so microscopy is required to view them. Giardia trophozoites have a sucking disc for attachment to intestinal epithelial cells. Heavy infections can damage the brush border of the small intestines, interfering with absorption, and this is seen particularly in children, resulting in malabsorption and failure to thrive. Treatment is available for giardiasis, and there are several medications that are prescribed depending on whether the case is an adult or child. Prevention is by restricting use of recreational water facilities, especially for children who are ill with diarrhea and still in diapers, showering and cleaning thoroughly after washroom use, and diaper changes before using recreational water. Children should also be taken on frequent bathroom breaks. Other preventative measures are similar to those for Entamoeba histolytica. Cysts are hardy and can survive in cold water for more than 2 months. They're also relatively resistant to chlorination, so contaminated surfaces need to be disinfected with quaternary ammonium compound products, or 6% hydrogen peroxide, or bleach. Water can be treated in a number of ways to either remove or inactivate any Giardia cysts that may be present as contamination. Heat water to a rolling boil for at least 1 minute or 2 minutes above 200 meters in altitude before cooling and using. Filters with an absolute pore size of 1 micron can also be used to filter raw, untreated water. Jug-type water filters should not be used, and built-in water filtration systems need regular maintenance, especially in high-risk areas. 2 drops of bleach can be added per liter of untreated water, which should be stirred and allowed to stand for at least 30 minutes before use. If the water is cloudy, the amount of bleach should be doubled. Dientamoeba fragilis trophozoates have 2 nuclei and flagellate ancestry, but lack flagellae. They were not considered pathogenic till recently. Infections are usually asymptomatic or with mild gastrointestinal symptoms, moderate diarrhea, irritable bowel syndrome type symptoms. The life cycle has not been fully determined, and the discovery of the cyst stage was only recently reported in 2014. Infections associated with pinworm infections have been questionable, although this was a common hypothesis for its transmission. An older Canadian report from the Manitoba Provincial Labs indicated that the incidence of Dientamoeba fragilis infections is likely higher than giardiasis. Many cases are identified accidentally when the stool specimens are submitted for diagnosis of other intestinal parasites. Another protozoan flagellate is Trichomonas vaginalis. Unlike the previous protozoans, which were all gastrointestinal ones, this parasite causes a very common sexually transmitted disease called trichomoniasis. Most cases are asymptomatic, and only about 30% develop any symptoms, which involve the lower genitourinary tract. This includes genital itching, burning, redness or soreness, discomfort when urinating. In women, there may be a thin-colored discharge with an unusual smell. The genital inflammation may increase the transmission of the human immunodeficiency virus, another sexually transmitted pathogen. This disease is more commonly reported in women than in men. Trichomonas vaginalis is diagnosed by detection and identification of trophozoites in genital or urethral secretions using microscopy. Immunofluorescence staining may be used to increase detection sensitivity. The trophozoites are pear-shaped and between 7 and 20 micrometers, so they need to be viewed under microscopy. Trophozoites have 4 anterior flagellae, a single large nucleus, and a short undulating membrane. They reproduce by dividing asexually. The cyst stage is absent. Treatment is available. It's the same medication as for giardiasis. Even though therapies are not included in assessments, I thought I should fill you in that metronidazole is marketed as a drug flagell. It can also be used as an antibiotic to treat certain bacterial infections. Trichomoniasis can be prevented by treating sexual contacts, as reinfections are common in about a fifth of the cases within 3 months after treatment. Having protected sex or abstaining till treatment is effective are also good ways to prevent transmission.